Thank you all. I'm thrilled to be here today to speak with Jack Newsom. Jack is a partner at Engagys. Jack has had an illustrious career over the last decade in helping health plans drive risk adjustment. So I'd love Jack to take a minute to introduce himself. Jack?
Yeah. Hey, thanks, Kathleen. Good to be here. I'm really excited to talk about this. So I've been doing risk adjustment, you're right, for a while. I got my start back at Senseo when it was, but before it was Signify, before it was CVS, as the vice president of analytics there, and built out an analytics team focused on trying to help them both identify ways to get members from different plans to take them up on that in-home annual wellness visit, and then also working with the providers to try to help them understand what they could do better. We've got some good examples of that we did there. And then I moved on to Caravan Health, which works with ACOs, largely in rural areas. And that was really more focused on trying to work with the providers' offices and build out the kinds of workflows and scripting and techniques that the practices could use to help standardize the work that they did in a way that drove risk adjustment and annual wellness visits in the office themselves. So all these things are sort of coming together in this context. So it's really exciting.
That is exciting because it's so important, Jack, to kind of address it from both ends, both from the member and the provider. Just for our audience, let's do an overview. Why is risk adjustment so important?
Yeah. So plans, this is in the news, right? Plans are in a tight spot. Medical costs have jumped up more than expected coming out of COVID. The kinds of rate increases that we've expected to see from CMS have been smaller than expected. So there's a real squeeze there. And what risk adjustment can do is help relieve some of that pressure by helping plans make sure that they have the resources available to take care of their beneficiaries. And what you see is that some plans are simply better at this than others. The Wall Street Journal had a great article this summer that pointed out that some plans are collecting 10 times more risk adjustment oriented money than others, even if their underlying populations are essentially the same. What makes it even harder is that because of the games and the rules around the HCCs, they have to replicate this effort every year, right? So it's become something of a treadmill where they have to go out and capture these diagnoses in a consistent and accurate way every single year. And when they do that, though, they can really find some additional resources to help the plans, right? So many of our plans will consider this about $1,200 in value for each annual wellness visit completed. Some plans even think of it as higher than that. So there's some real benefits to the plan in doing this.
And Jack, so important, right? To reach the full potential so that you can use those dollars to take care of your members. What is the best way for plans to do that?
Yeah, the best way to do this is to really focus on that annual wellness visit. It's the best format for collecting this sort of information. It's a structured visit that's got specifically addresses, conditions, diagnoses, gaps in care. So that's the place to start.
That's great. And many plans rely on in-home assessments as well to gather these HCCs. This seems like a more expensive way to get this done, but tell me about it.
Sure. So let's just think about the in-home visit is an awful lot like getting care in the emergency room, right? In some situations, it's absolutely necessary and the best place to get care. But in general, for most people, most of the time, it's better to have that care delivered in the primary care office. And the reason for that is you're developing that continuity and that relationship with that primary care provider, and you have the opportunity to not just take care of the risk adjustment, but also track down some of those gaps in care. So we've seen through various projects that we've done that folks that go in and have that annual wellness visit through their primary care provider are 35% more likely to stay with the plan from one year to the next. They're closing 5 to 10 times as many gaps in care as comparable members who don't get that done. And then the risk adjustment comes along with it. Those folks will generally have about 45% greater risk adjustment, not because anyone's doing anything like upcoding or anything like that. They're just seeing a doctor, they're getting it documented, and they're getting it documented consistently and accurately. So you can really improve that. And again, we've helped plans do this. In one place, we helped double the number of people who were getting their annual wellness visits completed by just changing up the way we approach them, right? We created some segmented, tailored messaging that went specifically to their needs and encouraged them to go in and see their doctors.
That's great. And Jack, in one example, you and I talked about, it's really about the barriers that kind of keep people from getting in to see their visits. You did some work where you found the barrier was transportation. Tell me about that.
Yeah. So you're spot on. We did a program where we looked at a population and we identified a group that was in areas that really had challenges related to transportation in the specific areas where they lived, right? And you can do that with publicly available information, which is interesting. And so we took that and then created some educational material that went out to the members that helped them understand how to use that benefit. I think most people will agree the transportation benefit is probably one of the harder ones to actually use, right? You've got to know who to call, which isn't the same as the member services number. There may be more than one transportation company involved. You have to be able to identify a time to go and then a time that you're going to finish. So there's just a lot of moving parts with it. And so helping members understand they need to do, how to make use of that benefit, they can actually do that. And when we did this for the population that I'm describing, we helped them increase the number of people that saw their primary care provider for that annual wellness visit by 17%. Okay. And then that rippled through to about 7 or 8% more annual wellness visits completed. Okay. And when you look at those folks, they only used a handful of rides. The people closing gaps, doing preventive care, only use a handful of rides a year. And so if it's $40 a ride and you're collecting $1,200 per HCC per annual wellness visit completed, that's easy. That's well worth the effort.
Sure. And you're right. The plan was probably worried that they'd start using transportation all the time, but they didn't. They only used it for what they needed. And there was an added bonus, if I remember in that example, where grievances went down, right?
Yeah, yeah. So that was the initial driver of that project, was more around satisfaction and focusing on helping people understand, right? By helping people understand their benefits, by reducing the number of calls into the call center, grievances went down, satisfaction went up. Everything moves in the right direction. There's a lot of opportunity related to that annual wellness visit to move almost everything in the right direction, right? We had another example where the in-home assessment vendor that somebody was working with was calling people literally 20 times in 3 weeks, right?
Oh,
And
oh my gosh.
so by identifying that and helping that vendor then throttle back the number of attempts that they were making, we increased the number of people that were actually taking their call and not just ignoring it, right? Because they weren't getting bombarded. So now you've got the success of that program increasing, you've got satisfaction increasing, and you've got people going in and getting their annual wellness visit. So it's a fantastic example of less is more sometimes, right? When we integrate all these pieces, think about it from the member's perspective, and put it together, you can really just hit on all your measures all at one time.
It's amazing. And the exponential positive impacts from that one visit just keep, resounding. I came from the consumer world, and a really interesting stat from American Express was that if you don't connect with those consumers and get them sticky in the first 3 months, getting them to re-enroll is an uphill battle, right? It's all about the loyalty made in that early part of the year, that early part of the relationship. And so AWV is the answer to solving so much of that. So that's a great example, Jack.
It's funny. I always think, when you've told me that story before, and I always think of when my son started in the Boy Scouts. One of the things they try to do is try to get them their first merit badge within the first 3 months for exactly the same reason. So they don't get, they have some tangible success, they feel part of it, and they start moving along.
Absolutely. That's a great example. We hear a lot about fraud, waste, and abuse coming out of the news these days and coming out of DC. What can a plan do to prevent falling into that trap?
Yeah. Risk adjustment is something that where there are, again, we've been talking about the value that one can gain from it, right? So there are a lot of incentives to cut corners, but the Health and Human Services, the Inspector General, has made it very clear that upcoding is going to be monitored, captured, and punished. And last year there was one national plan got hit with a $172 million fine. Executives have gone to jail, and so what you really need to do is focus on accurate, consistent coding, and that's what it's all about. And if you do that and you do it regularly, you'll be in a good position.
Terrific. So, what's the number one takeaway for plans that are listening where do they start?
Yeah, I think there are really three things to focus on. The first is working with your providers to help them get patients into the office, right? About 45% of all Medicare members across the board will get an annual wellness visit. But if you break it down at the provider level, there's huge variation, right? Some will be doing more than 70, 80% of their members getting that done. In other cases, it'll be a handful of patients, right? And so what you need to do is find, and you can do this with the claims data, right? You can find those people who just aren't doing a lot of those kinds of visits and help them, right? You can help them with information around setting up a workflow for their practice to handle annual wellness visits, help them understand the coding so that they can get paid for the work that they're doing, and provide them with templates around communications that their front office can use to help talk and explain what an annual wellness visit is, why people should come in and do it. So it includes FAQs, it includes a template letter, things like that to help them do a lot of that work for you. You can also then, I think the second part of this would be to focus on helping members. And just like we described with the transportation example, try to, to the extent that you can understand what's going on with your members, you can specifically address their challenges, right? So if they're having transportation problems, help them understand how to use and benefit from that service. And then that will help them get into the office on their own as well. And then the third part of it is really collaborating with those in-home assessment vendors and making that whole process work more smoothly and more seamlessly for your members, right? That they have an incentive to really try to drive visits. You're a little bit more concerned about satisfaction. And as we described a moment ago, there's definitely scenarios when people will be over communicated to or sort of walk away saying that they feel like they get called from one of these in-home vendors constantly. So if you can, one, help them throttle back on the amount of communications that they're doing to a given member in a specific short period of time, that's helpful. Another thing is to just help them make that visit more relevant to the patient. So just like we were describing with the transportation, we did this with one program where we broke things down into different segments of the population. There were a group of people who did not have a primary care provider, right? So the messaging becomes, hey, you don't have a primary care provider, we've got one for you. Or again, the transportation might be a segment that you could work from and say, hey, if transportation is a challenge for you, we'll send a doctor to you. So the more you can be specific and relevant to the member, the more you can help them address their specific needs and be successful and help them be successful as well. So that's the way to make all of this come together.
That's fantastic advice, Jack. Thank you for taking us through that. When you mentioned about, if they don't even have a primary yet, telling them to go get their well visit can be daunting, right? So pick a primary first. We saw that we helped a plan drive a next best action inbound that way. Same thing. If they hadn't picked a primary, assigned a primary. If they had already picked a primary, it helped them schedule a well visit, and the success was overwhelming. So there's so many different ways to address getting members to get their well visit or take their home assessment. That optimizing kind of at every step of the way sounds like it's the key.
And that's a really good point. Is starting by meeting the member where they are, right? I think we've done another program that was more aimed around colorectal cancer screening, and the idea being, if I don't have a primary care provider and I'm not getting any of my preventive care done, trying to present a colorectal cancer screening to me is a stretch, right? Take it back and say, hey, step one, Jack, let's help you find a primary care provider, right? Start there, and as opposed to jumping straight to something that might be a little bit harder to complete or something that somebody might be a little bit more afraid of jumping into.
It all makes sense. And Jack, thank you so much for taking this time. This is such valuable advice. I think everyone listening is going to help. It's going to help them improve their risk adjustment efforts. So thanks again.
Thanks a lot.